Last week, my next guest said, if we are to control outbreaks, we must focus on people. Dr. Perry Halkitis is the Dean of Rutgers School of Public Health. Welcome back, Perry.
Hello, Alex. Good to see you.
What did you mean by that when you said focus on people?
Yeah, so I think what we've done over the course of the last 2 years is really focus on the virus and what the virus does. And we failed to realize that people are the ones who carry the virus. People make decisions about masks, people make decisions about vaccination. So what is it that people need to do to stay safe?
So as a public health expert, do you feel like public health experts did a good job communicating to people during COVID overall?
I think that the messaging was confused. I think that it felt like it was constantly changing and people didn't appreciate the fact that new science was coming along. I would have liked it to have been a little more clear and more direct. And that's what people want. Just tell me what to do. But every few days, they got new directions. And that created a level of confusion, I think a level of frustration, and at the end of the day, some mistrust in the system.
Do you think that we relied too much on the 1918 playbook? We went back to the last pandemic and kind of tried to copy and paste some of those lessons?
We might have. I wish we had used the HIV playbook. I mean, that's what I've been writing about. I think like in the 80s, we learned a little bit about how people respond to disease and what we should do. We should have used that a little bit more. There's a bunch of us who been fighting that HIV war for a long time. We could have informed that, and we didn't do it. It's 2022, it's a different world than 1918, even in 1980. And so it was complicated by the fact that we are in this new technological, global community. And yeah, maybe we rely too much on the past.
Do you think that we did learn the lessons of the AIDS pandemic? Did we apply those correctly?
No, we didn't at all. You know, during the AIDS pandemic, we also kept thinking that people were going to make rational decisions. We still think people are going to make rational decisions, whether it's about COVID vaccination or monkeypox vaccination or wearing a mask. People don't make rational decisions all the time. They make decisions on what they need to do, what makes them feel good, and what the realities of their lives are every single day. Some people don't have an option to leave work and get a vaccine. Some people don't have an option to miss work because they're not feeling well.
Or work from home.
Or work from home, like I was able to do, getting the best sweatpants in the world, over the course of the last 2 years.
Breaking them in. You had in your op-ed a line that I think is great. You said, take 2 aspirin and call me in the morning is the ethos that has shaped our responses to the pandemics of the past 4 decades. Okay, what should be the new ethos?
The ethos should be, how are you feeling? What do you need to be able to deal with this disease? Something like that. What I meant by that sentence was, if you treat disease as purely biological, you're going to fall short. Diseases are not just biological. Yes, a virus is biological, but human beings are psychological and human beings are social animals. And unless you develop strategies, prevention and care that addresses that, you're going to fall short.
We're coming up on, in March, 3 years of COVID. Right now, what do you think, what are the responsible mitigation strategies to take, if any, in regards to COVID now?
Yeah, so let's be clear. No one's wearing masks. I mean, anybody can see that, right? I went last Saturday and got my bivalent booster. That's the best thing we can do right now. Get your booster. And as I said, I don't know, a year ago, Alex, when we were talking, this is going to happen annually, this vaccination. And, the CDC finally acknowledged that. This is what I mean about the messaging, too. Why couldn't we have said that a while ago? We kind of knew that was going to be the case, and we waited. So take your vaccine, wash your hands, all the things our moms and dads taught us. Wash your hands, don't cough on people, all the things we do for a common cold we should be doing here.
In the last minute we have, how concerned are you about the flu season this winter?
Yeah, so I'm concerned if the vaccination uptake for the flu vaccine is not as good as it has been in the last couple of years because of COVID. I'm concerned because the people are not wearing masks. So I think we're going to go back to the same patterns we saw before with the flu, right? Very high elevated rates. 20,000, 25,000 deaths a year. We never talk about that.
Nationwide, right?
Nationwide, 25,000 deaths a year. And I think the only hope I have is that people in their concern for COVID might elevate their willingness to be vaccinated for the flu and take the same strategies they're using to protect themselves from COVID to protect themselves from the flu.
All right, Dr. Perry Halkitis, Dean of the Rutgers School of Public Health. Thanks for joining us.
It's a pleasure, Alex.
As for you, stay with us. There is a lot more coming up today. This is New Jersey Power and Politics.